and good evening to everybody. And thank you for joining us for our Ask the Expert event. This is Game On, Pediatric Orthopaedics and Sports Medicine. My name is Dr. David Gerd. I'll be moderating tonight's event. Joining me are two excellent pediatric orthopedic physicians, Dr. Ace Egger and Dr. Kevin Serdaley. We appreciate your time and look forward to answering a broad range of questions regarding prevention of sports-related injuries in children, promoting healthy bones and joints, and more. But before we get started, I'd like to take a moment to introduce ourselves and share a little bit about our practices. Again, I'm David Gerd. Love working with kids. Do the full gamut of pediatric orthopedics, but have a specialty in spine-related issues like scoliosis and hip-related issues, but love dealing with and helping kids through traumatic events like fractures and extremity deformities and all parts of it. Dr. Egger, please tell us about yourself.
Yeah, so similarly, I'm Ace Egger. Excited to be here and have this conversation with everyone. So I also am a pediatric orthopedist with a little bit more of a specialty in sports medicine. Did an extra year of training in that. And so that would be a lot of my elective practice is dealing with sports medicine injuries in sort of the pediatric, adolescent, and young adult population. But yeah, similarly, also take care of a lot of trauma as well. And
Dr. Serdaley, tell us a bit about yourself.
Yeah, absolutely. So pretty similar to Dr. Gerd. I take care of a little bit of everything, which is sort of the nature of a lot of us in this space. We in the pediatric world, we kind of manage most orthopedic conditions, and so. But a little bit of everything. Also have some specialty interests in spine and scoliosis. But certainly kind of see and take care of everything. I think a lot of us manage a lot of trauma as well. I think that's sort of the nature of our specialty.
Well, very good. Thank you both. And again, thank you for joining. We'll now jump into questions and discussion. So first question that we'll discuss, what are the most important milestones for bone and joint development in children?
Yes. Good question. There's a variety of them, and some of them, are kind of in the weeds, and some of them are more broadly speaking. I think the things that we see the most commonly in clinic, certainly from a milestone standpoint, are related to predominantly lower extremity deformities. It's at least what I see the most of. And we see a lot of patients that are referred over for in-towing, which is actually surprisingly common amongst young children and can certainly be normal anatomic variants many times as well, related to twists in the femur bone at the hip, tibia bone, or even down at the feet, and sort of monitoring that as we would expect that to change over time. And then another big one that I think we all see a lot of as well is bow-leggedness, knock-kneed as well. That's one that you kind of see on a daily basis. And there's some kind of ages where we expect to see that, and then there's some ages where we don't expect to see that, and we can kind of use those as landmarks for, hey, is this normal? Is there something going on here?
I would also, with that, point out age related and talking about sports, so common as kids are reaching their like peak growth that are athletes. It's so common to see things like Osgood-Schlatter, Sinding-Larsen-Johansson, Sever's disease, which are all where the growth plate is growing rapidly. So it ends up becoming like the weakest part of the body. And so if you're doing a lot of overuse, if you're overdoing the amount of activity you're doing, you tend to get quite a bit of pain there. The first answer for that, which no kid ever wants to hear, is that, calming down the activities in a period of rest is a good idea. But flexibility and stretching for that are so important also.
Absolutely. I also find it funny that, we had to name those things such terrible sounding diseases after long, lengthy names. I feel like I'm always reminding people, hey, somebody just wanted to name this after themselves. I promise it's not going to be the end of the world for your kid, even though it sounds like a crazy name.
Yeah. The first two are just inflammation of the growth plate about the front of the knee and creates pain. It's just inflammation. It's nothing worse than that. And then the other one, the Sever's disease, is about the heel. So again, just inflammation of the growth plate, but it sounds much worse. You're right.
And so, Dr. Greer, would those fall under the quote unquote growing pains, or do you find that as something sort of being different? And how, where do you find that diagnosis, and when our parents should be concerned for that?
Yeah, it's a great point, and it's a question we have later. But it is growing pains, but I think most of the time when we see real growing pains, it's in a younger child who, you go through a couple different spurts of rapid growth. The ones we were talking about are typically early adolescence. The growing pains are more of a diffuse leg pain, not really to a specific area. And if you think your kids are growing rapidly, the bones are getting longer, the ligaments, the tendons, the capsule all have to catch up. Some kids are just more predisposed to being tighter as the bones are getting longer, and then get a pain that typically tends to be as they're going to bed or right after they've gotten in bed. It tends to get better if they use heat. The parents do if they do a massage. Sometimes when they wake up in the morning, they're really sore too. And then next thing you know, they're out running around doing everything throughout the day. And then typically you'll see the growing pains worse after a very active day. But again, it goes right back to that whole realm of stretching and, how do you get your 6-year-old to stretch? Things like Cosmic Kid Yoga, pulling it up on YouTube and just following along doing fun things, but it puts the body through dynamic stretches that are so important for keeping things loose as the body's growing and as kids want to be active.
Yeah, I completely agree. I use that same analogy in clinic. I tell patients that, the bones are growing a lot faster than everything else. And so, if you think about, an elevator, going up and the rope is then catching on the dumbbell, like it starts to then pull on a lot of these growth centers, where in adults, our bones are tibia, our femur, it's one fused, thing, versus in kids, they have all of these little growth centers where then, these muscles and ligaments are pulling on smaller areas of bone and creating that friction and that, as you said, inflammation that causes the pain, especially in sort of these more isolated situations.
Mm-hmm.
And then question number 2 is, how can parents tell if their child's posture or gait is normal or needs evaluation? And I'll start this one. Kevin had kind of hit it on the head. Early on, kids have a lot of rotation, typically the toes turning in. Babies are typically born bow-legged. By 18 months are neutral. By age 3 to 4, they're really knock-kneed. So those are things that can look really weird, but are normal. Scoliosis, you're looking for that. Typically you'll see one shoulder, most frequently the right shoulder, higher than the other. If you have your child bending forward, sometimes you'll see the ribs are higher on the right side than on the left. So those are things to look out for. I think the key with it though, and I'm going to say antalgic gait, like if you're running and it hurts, okay, that's odd, that's different. But there are some things like early Perthes where, the kids are 5, 6, 7, they're not really hurting, but when they go and they're playing soccer with their friends, they're running funny, the leg is kind of scissoring out. So there are some things that we see where antalgia or pain is not really associated with it, but could still be leading to an abnormality that would, need to be treated or to modify what they're doing to help protect it, to allow it to grow normally. But I would say the key thing for this is looking for pain. And if you're seeing pain or if your child's feeling instability, that's where you go to get checked. Posture, I hear from parents all the time about posture. In my book, it's not so much reminding your child to sit up straight, stand straight. If when they're on their games, when they're doing stuff, they're going to be in a poor posture position. And I'm not saying, spend a lot of screen time, but I think the key to that is flexibility and core strengthening. And if you're working on that, you are going to fix your posture innately. Thoughts on that, guys?
I agree. I watched both myself and Dr. Egger just kind of correct ourselves, sit back upright in the chair. I do that all day. I talk, talking to people about back pain or, scoliosis and posture correction. And while I do it, I'm sitting hunched over in my chair, sit back up every time. So but agreed. I think a lot of that actually ends up coming down to core strength. And I think that's where, if you're really working to build posture, core strength can be super helpful. I think to wind back just a moment, I think one other thing that can be an indicator of, hey, is something abnormal here, can also be asymmetry in some instances where, a lot of the quote unquote normal development things that we see often have some degree of symmetry. And if things are asymmetric, one leg is circumducting, in the Perthes example, and the other one isn't. Things like that are also reasons to say, hey, maybe we should go get this checked out. Now, sometimes that's still very normal too, but that can be a sign.
Yeah, I completely agree. It's a lot of times it's someone else that's sort of noticing it, grandparent or somebody else that you don't, it doesn't see them all the time. And again, as Kevin said, most of the time it ends up being, normal, and part of our treatment algorithm has definitely shifted, over the last 30 years, where things we used to get put in braces for, or different things like that, we now know or have a natural course of being normal. But I would echo their sentiment that if there is a concern, it never hurts to get checked out by one of us.
Yeah, and what Dr. Egger is mentioning there is the turning in of the feet. We used to treat with like twister cables, crazy braces, until studies were done showing that those kids that were treated that way didn't get any better any quicker than those kids that we just left alone. And then the example of, the two best basketball players ever with Michael Jordan and LeBron James. Michael Jordan's feet are so turned in. LeBron James is like Charlie Chaplin with his feet turned way out. So just such a variance of what normal can be too.
Absolutely.
But the asymmetry, Kevin, that's great. I think that's a perfect point. If it's asymmetric, that could certainly be something causing it that would need to be investigated. And now along those lines, what are the most common developmental conditions in young children you see in your practice?
Oh boy, I think we've touched on a number of them here over the last few minutes. I think the things I definitely see most commonly, just day-to-day basis, in-toeing, very, very frequent, bow-leggedness, very, very frequent, or knock-kneed as well, really depending on patient age. Hip dysplasia, I think we all see fairly frequently as well. And there's, in the United States, we do a decent job, I think, at screening kids for that, at least the ones that have risk factors. And so we see a fair amount of kids with screening ultrasounds from prenatal risk factors. And some of the other things we haven't touched on, certainly like trigger thumb, another real common developmental condition that we see on a pretty daily basis. And then scoliosis as well. That one's a big one, day in, day out. Mild, it runs the gambit from mild to severe, and from, really young kids all the way up to teenagers or even young adults with neuromuscular conditions. So that's the great thing about peds, is that we get to see a little bit of everything on a day in and day out basis, not to mention sports as well. Not to forget about, all of the sports injuries and all those things that I know we'll be digging into here as we get going as well.
And you mentioned, dysplasia and some of those risk factors. Could you kind of elaborate on what dysplasia is and what some of those risk factors that people would be looking for?
Sure. Absolutely. So hip dysplasia is a sort of a developmental problem at the hip. The hip is a ball and socket joint, and as the body grows and develops, they sort of work cohesively for that to grow as a unit. And the cup kind of shapes around the ball, so to speak, in order to get a concentric hip when you're older. And we know that, I should go further with that. Hip dysplasia is when there's an abnormality in that anatomy. Oftentimes that's a shallowing of the cup. And then with that shallow cup, when the edge is not cupped over the top like that, that femur bone, the top of the femur bone, tries to start migrating out and can even get to the point of a hip dislocation, which can certainly be a pretty significant problem. So our goal is to recognize that problem early on and treat it at a very young age, even, as infants, to try to keep that femur tucked down there in the socket so that it can develop around each other correctly. Risk factors for that, though, are some big important things. Any child that's firstborn, a firstborn female especially, and then a firstborn female that is breech positioned at any point during the pregnancy. Those are all some of the bigger risk factors. Breech positioning, probably the number one factor, although family history plays a big role too. In the United States, any child who is breech position at any point during the pregnancy should get a screening MRI or screening ultrasound. And I know our pediatricians here at the clinic are very on top of that. They do a nice job. And sometimes there's some small changes, but sometimes there's some big changes. And when we see the big changes, we want to be able to jump on that early, because we can, it's a bit annoying on the front end, but we can do things that are a bit annoying for a couple of months to make a really lasting, lifelong impact and avoid some real big surgeries down the road, which is pretty cool.
Yeah, absolutely. All right. Anything else on developmental issues? Otherwise, this next question kind of brings us to the juxtaposition. Yeah. The next question is, what are the best ways to prevent sports injuries in active kids? That's what this all comes down to.
Absolutely. So I think there's a lot of answers to this question. I think that there's a number of things that play a role, and we're going to touch on a lot of them here, I think. And, I think the reality is sports injuries are inevitable. They're going to happen. That's just the nature of being active in sports, and we try to limit them as much as possible. But, if you're going to play a sport, there's a chance, I think a lot of us played sports growing up, and that's sort of part of playing sports too. So the goal is to try to limit or set ourselves up for success and minimize the risks as much as we can. I think we'll touch on this, but I think trying to avoid overtraining in specific areas is super important for your more overuse type of injuries. Wearing appropriate protective equipment, particularly in the contact sports like football, tackling correctly, and making sure that we're teaching those things correctly to the young athletes to avoid head injuries. All those things are setting ourselves up to be successful in sports and trying to avoid those injuries. We were just talking the other day. I was looking through some articles. The other thing I found this kind of interesting. I just found this study, although it's from a number of years ago in Journal Pediatric Orthopaedics. But I found this pretty interesting. They found that kids who get less than 8 hours of sleep on average have a 1.7 time higher risk of sports injuries. And that's not one that I would have, picked right from the get-go for this. I think, some of the stuff I already talked about, a lot of it, you would say, hey, that's probably, kind of common sense to a certain extent. That's one for me that I did not think of as common sense. And I think is an important thing to consider.
So kids should not bring their phone or their device to bed.
Correct. Good sleep hygiene. I mean, that's important for us too, but in the context of our conversation today, certainly there's some concrete data there to suggest, hey, we got to be getting 8 hours, and we should probably be trying to get good sleep.
Ace, while we're on this subject, do you mind talking about, you do a lot of ACL surgery. Do you mind discussing ACL injury prevention?
Yeah, absolutely. So, ACLs are pretty rampant in our culture right now, and becoming younger and younger. And, there's different theories on why that's happening, but there is definitely some identifiable risk factors. Sometimes it happens when there's bad luck, but some of the risk factors, that we can control. A lot of it is specifically sort of looking at alignment. So, if they're really knock-kneed, that can be a risk factor, as they get a little bit older. There's some, genetic component to it as well that unfortunately we can't really change. And then starting to look at sort of neuromuscular control. And what I mean by that is sort of the way that as they're jumping and landing, that knee not diving way in. So when they land, that's a huge risk factor. And that's what a lot of the prevention programs sort of focus on. Probably the most well-known one is the FIFA 11 program, which is, again, geared towards soccer athletes, where there is a significantly high rate of ACL injuries. And a lot of that focuses on, flexibility as well as hip and core, type strengthening to really work on, making sure that your quads are not too strong so that your hamstrings are lagging behind, and really making an equal neuromuscular balance, and really focusing that as you're landing, you're kind of landing softly, not hard landing, not knee diving in. And so, we do that preventatively, but also in the afterwards, after we do the surgery. That's a huge focus before we get patients back into doing sport. They have to show us that, hey, they've regained that neuromuscular control.
Yeah, absolutely. Thank you.
Mhm.
And Kevin, here's a tough one. How much physical activity is recommended for children at different ages?
That's a great question. I planning ahead for some of this. That's that's one that I actually had to dig into a little bit, and turns out there's some really good recommendations from American Academy of Pediatrics regarding this, and so you'll have to excuse me. I'm doing a little bit of reading on a screen here, but they kind of break it down by age, as far as infants kind of 0 to 1 years old, toddlers 1 to 3, getting a little bit older 3 to 5, and then sort of getting adolescents beyond that. Infants, a lot of that focus is going to be on getting them activity and engagement as you can. Tummy time, at least 30 minutes a day, I know is a big and growing thing in the pediatric community as well. And then actually the one that I kind of found the most interesting is that, I think we think as adults, we talk about getting your, 30 minutes to an hour of activity a day. I think we've all kind of heard that type of recommendation. But, when you look at their recommendations, they're really actually talking about trying to get 180 minutes or 3 hours a day of activity. And now not all of that is sports. And I want to be cautious because I think a lot of what we're going to talk about too here is avoiding overtraining. But getting a good 3 hours of activity in per day, trying to stay away from the, screens as much as we can, keep moving. As you get a little older, they talk about trying to get at least in that 3 to 5 age, 60 minutes of that should be more than just light activity, getting into a little bit more vigorous activity, running around, playing a little bit more. And part of that, you get in as being a kid as well. But I kind of was interested to see that that number is actually as high as it is. And then when you get a little bit older, you get a little bit closer to your kind of adult type recommendations. You're at least 60 minutes per day, trying to do vigorous activity at least 3 times a week, bone and muscle strengthening activities at least 3 times a week. And sports is a good way to get a lot of that in.
Yeah, I can say that I have a toddler, and getting 3 hours is not hard. They don't stop moving. But no, and then I think for specifically talking about training and not just being a kid, quote unquote, and playing, the American Academy of Pediatrics also, they talk about not having that age of training per week. The hours of training per week should not exceed the child's age. So an 8-year-old really shouldn't be doing more than 8 hours a week of training, versus a 16-year-old. That's a very different patient population in terms of the volume and the hours in which they're training.
Yeah, and I don't know what you guys think, but my opinion is kind of since COVID, we're almost at 2 extremes. We have the one extreme, which is probably the parents that are following us today, of kids who are now just joining sports and doing it, all year long. And then the other extreme of kids who are just on their computers, on their phone, and really not getting any activity. So I do a big push for those other kids. How about even 8 minutes a day? Get on the floor of your room and do something.
Mm-hmm.
So
yeah,
I need to push for that too.
Yeah, absolutely. Speaking of getting into activities, what do you guys recommend as far as stretching out, getting loose, getting ready to play sports or getting ready to do those activities?
Yeah, so like warm up for sport, I think it's really going to be all about a good dynamic warm up. Flexibility, I preach it all the time in clinic. Ace will probably laugh because he was a resident with me too and heard me preach it all the time. Flexibility is so important, but it's not the key thing to do right before sport. Flexibility is kind of throughout the day at different times. Before sport, the key is a dynamic workup. You're really just trying to get things moving, increase the blood supply to the muscles, get the central nervous system kind of engaged and kind of wake it all up. So it starts with motion. And if you go and watch a college football game, you'll see the wide receivers are out there just kind of moving their legs back and forth and then forward and back, and then, opening the gate with the knee up on both sides and closing the gate. And it kind of seems silly. What they're doing there is just getting things loose, the muscles ready to get going, getting the vascularity going, getting your nervous system ready for everything. And then once you've done all the motion exercises, then it's really starting to build up get jogging, and then going from jogging to 3/4, then getting to full sprint, starting to do full cutting and everything. But the body has to be ready. I loved when I would coach my kids when they were young and they'd show up to practice and everybody just right away is boomed. If it's soccer, they're straight out running and playing against each other. Basketball, they're straight out to the 3-point line, shooting up threes. Yeah, and when you're young, maybe it doesn't matter quite as much. But as you become a more serious athlete, the dynamic warm-up is absolutely so important. And then flexibility, I have to talk about it. If you are in a sport, if you play wrestling, football, soccer, any of these, you see the collisions, the position that the body gets into. If your body is not ready for getting into that position, if you have not worked on that flexibility ahead of time, that's when you're going to run into hamstring strains. That's where you're going to run into hip pointers, back pain from overstress in the paraspinal musculature. So I have to get my plug in for flexibility too. It is so important. You
Absolutely.
see a lot of the Division I football teams doing yoga 2 months going into the season, 4 days a week. I tell the kids, the boys that in clinic, they're like looking at me, sideways. But yoga, Pilates, things like that are a wonderful way of, anything with dynamic stretching is a wonderful way of getting your body ready.
Yep. Absolutely.
Yeah, if you go to the highest level and talk to any professional team trainer, they have a 2-hour workout, an hour plus of it is spent on flexibility, core strength, Pilates, like those types of things. Yeah, they all have the show muscles and things like that, but that's not where the power of an athlete comes from. It's from that center, hip, and core. And as you said, flexibility is the single greatest key to preventing injuries. Injuries can still happen in the most flexible people, but the more loose and the more limber those muscles and those tendons are, the less likely they are to have a pull or have some sort of injury happen.
Excellent. How can parents balance sports participation with avoiding overuse injuries? And it's a great point. You want your kid to be the best. You're going to do everything you can to help them be the best. How do you know when you're doing too much?
Yeah. And I think you a couple minutes ago, you also made a point of, I think we've kind of diverged on two paths of oftentimes, a lot of very, very active and then maybe not as active. But I think another thing that we've seen, and this is maybe a trend even beyond the last couple of years, is maybe over the last decade or so, but we're seeing this trend of hyper specialization in sport. And I think avoiding overuse injuries starts with cross training. Flexibility, certainly the things we just talked about, but I think cross training, trying as much as possible, at least for me, to get involved in more than one sport if you can, so that you're using different muscles on a daily basis, or at least at different times throughout the year. I think there's a study out there that suggests that if you're doing the same sport more than 8 months out of the year without, breaks or going to another sport, you have a much higher, almost 2 times higher likelihood of an overuse injury. And so trying to cross train, if you can only be in one sport, at least cross training different muscles, or, getting into other sports when you're able to, giving some muscles a break and getting into something else. Along with taking a break, though, mandatory rest periods, I think, are really important as well, especially when we're talking about throwing athletes. I know we have a pretty big baseball and softball community in this area, and we see a lot of overuse throwing injuries. I think we'll touch on this in a little bit as well, but getting into your pitch count, your mandatory days of rest, we kind of think of, in the past, have thought of those things as things that professional pitchers do. The reality is it's just as important, if not more important, to be doing those things in our younger athletes to prevent those overuse injuries, which is all a long-winded way of saying try to use different muscles as much as we can and make sure that we're actually taking rests.
But how often do you see that kid in clinic where one of the parents is like, but he's their only good pitcher?
Yeah.
We got to give him a break. The Guardians
you,
pitchers are not pitching every night. They're taking a break intentionally because the body needs it. And, on those
Yeah.
break times, it doesn't always have to be a break from everything. It's a break from the high impact, repetitive stress you're doing to your body. Doing low impact, doing calisthenics are really good on the other days to give your body a rest, but still keep things moving and still keep you fit.
Absolutely. Yep.
The other opposite you see is the high school players who, say soccer is starting up. And I say that because I've seen it with my kids and some of the players on the team, and they show up for the first practice, and you could tell some of those kids have just been on their phone all summer long. And then that first practice is a bear. So making sure that your body is ready for what you're getting into, I think, is super important too.
Yep. It's a balance. It's absolutely a balance.
So then getting into the next step of this too, what signs indicate that a child's pain might be more than just soreness? And it's a good question. It's kind of a difficult area. If you have a child that plays sports, there are going to be days that they are hurting. There's no doubt about it. It's the same thing if, one of us is going to prepare for a marathon. If you go out that first day, you run 8 miles, man, you are going to be hurting. But is it real pain? Is it just kind of muscular irritation? And I think from a parent standpoint, that is tough. I think if it's persisting, so that's probably the biggest thing. If it is just muscle irritation, going home, stretching, icing, resting, keeping mobility to the area. And if over the next day too, it's better and they're back doing everything okay, then we know that's what it was. But if it's persisting, if it's lingering, if they try to get back to their sport and it's amplifying, that's a big sign that it's real. If there is pain in a specific area, like distal radius fracture, sometimes it's really hard to know if you have a buccal fracture of the distal radius, but if you palpate that area circumferentially around the bone, it hurts. Okay, that's a sign that that's real, more than just a sprain. Swelling, if you're, identifying swelling in an area, well, there's bleeding going on there. So it's more than, just a mild irritation to the area. Any other thoughts on that with you guys?
Yeah, I mean, I completely agree. I think if I was going to say the exact same thing. Like persistence is the biggest thing. Like if it's happening every single time, they're playing, I think that's definitely something that, and it's, kind of a localized thing. I think that's definitely something to, pay attention to.
Yeah. Yeah. And, for some things it's fairly obvious, if you have, some forearm fractures, it's, you know it right away. You can see it from across the field. Right. And so those things are fairly obvious, but it's the ones that can be a bit trickier, and especially in kids, kids get injuries that adults don't get. So if you mentioned buccal fractures, right? That's not really an injury. It's every once in a while, but it's not really an injury that adults have. And whereas kids, they're going to have some swelling there, but it can be tricky sometimes. I mean, I think we all see kids who, come in a week out from the injury, and the parents feel terrible because they think, oh, we just thought it was just a sprain, and come to find out, hey, there is a buccal fracture there. And so it's certainly tricky sometimes with kids. And so, I think parents know their kids the best of everybody too, to a certain extent. And so, from that standpoint as well, if you're seeing your kid do something that is just not normal for them, you've seen them get a bump or a bruise before, but hey, this just seems different, even if it doesn't look too crazy looking at it, from across the field, so to speak. That may be a time to think about it too.
And it's not just the bad parents that miss it or come in late. We have seen some of our orthopedic colleagues' children who also come in
Yes,
late.
absolutely. Probably more likely, actually. I think I've seen that more frequently than anybody else from the public as well. I think we're kind of even extra inclined to say, you're fine, just rub some dirt on it and get back out there. So.
And then next question is, when should parents seek medical attention for joint muscle pain? I think persistence and the things we just discussed. Does anybody have anything further for that? Okay.
No, I think those are the big ones.
How can parents spot early signs of scoliosis or other spinal issues?
Oh, that's a great one. I love this. what we used to do in the past, there used to be, school physicals and screenings and things, and we still do that certain places to an extent, especially with high school sports, to tie this into sports a bit, getting your sports physicals done. So, but doing that, or anytime you're seeing your child's pediatrician as well, particularly as they're getting closer to the age of puberty, they really need to be checking their back at least once a year for those visits, and that's doing that lean and forwards test that everybody probably remembers. Keep your knees straight, lean forward, try to touch your toes. It's also a time when I tell everybody to stretch their hamstrings, because a lot of times we're talking about flexibility. That's the time where I see a lot of hamstring tightness is checking for scoliosis. But should really be doing that screening at least once a year, whether it's at a school physical or with your pediatrician, especially for anybody who has a family history of scoliosis. And then I think we actually probably are sometimes late to picking up on scoliosis as well, because we live in the north as opposed to our colleagues that live down in Florida, where everybody's wearing t-shirts and swimsuits and kind of year round. We spend half the year, if not more, wearing big bulky sweatshirts and staying warm and keeping everything kind of covered up from that standpoint. So it can be a little bit trickier to catch those things sometimes. So keeping a close eye with screening. Other things you might pick up on would be shoulder imbalance, is one that a lot of families will point to as the first thing that they said, hey, yeah, we just noticed our son or daughter, we were walking behind them at Cedar Point this summer, and kind of one shoulder was up like that. I don't think it was like that before. And lo and behold, we get some x-rays and there you go. We see some curvature there. So keeping, as you start to see a curve that's substantial enough that we want to be seeing you and following you in clinic, oftentimes we're going to be starting to pick those things up from a clinical standpoint. And that's where that screening is really important.
Yeah, going for homecoming dress, shopping too, is a common time to see it. So if you see somebody with scoliosis, do you limit what they can do sports-wise?
I generally do not. The only time I would limit somebody from sports would be if we got to the point where they had a spinal fusion surgery. And there's some contact sports where, after a big spine fusion surgery, it'd be more of a discussion, like football after that type of thing can be a little bit dicey. But certainly, short of having any surgery, I would encourage people to stay active and continue to do the sports and activities that they want to be doing.
Yeah, I think it's a really important point. Just having scoliosis does not put the child at more risk. So, playing sports, being active is still super important. Very good form. Thank you.
Play away. Absolutely. We talk about back pain in kids with scoliosis as well. Certainly, that can be the first sign in some instances, but a lot of kids have back pain, just like a lot of adults have back pain too. And so, sorry, excuse me, trying to work on that flexibility with or without scoliosis, stay active. Those are things that can build that core strength. Those are all things that can be helpful with just the back pain side of things as well.
But scoliosis is frequently not the cause of the back pain. So I think, yes.
Almost always not the cause. People who have scoliosis also have back pain. People who don't have scoliosis also have back pain, and it's oftentimes the same cause.
You can tell that we like scoliosis as we move on our tangent. Let's get back.
I know. We brought on two people who love scoliosis in addition to sports. So we'll pivot back to sports here.
Well, now I want to get to the question where I want to hear Ace's answer. Is it safe for young children to specialize in one sport early on?
Yeah, so I think the answer is yes and no. And what I mean by that is, can you do it? Yes, but you need to do it with some guardrails and you need to do it safely. So when I think about, sports specialization early on and from a safety standpoint alone, I think following those guidelines of not overtraining. So, if it's an 8-year-old, again, following the limitations of, doing, let's say, gymnastics, for 8 hours a week and not 20 hours a week. I think having the adequate amount of time of rest, as Dr. Sudeli mentioned, throughout the calendar year is super important. So you're not just doing the exact same thing for 12 months at a time. Usually taking at least a 1 month break, once or twice a year, I think is super important. And then I think that's the biggest thing is, for some of these individual type sports, people have a concern and a debate about, they really need to, specialize early on. And again, if that means just doing one sport, I don't think that's a bad thing. But if they're only doing that one sport to the highest level of, maximum time, I think that's where things can get a little dicey and you can start to see some of these injuries.
But Dr. Egger, Jimmy's soccer team has spring, summer, fall, winter. And if he's not on each of those teams, they're going to drop him and he won't be able to be playing at that level. What's he going to do?
Yeah, so I think that's a really difficult conversation and a real conversation that I have, and I'm sure we all have, every day in clinic. And I think I would point to them, especially in the team sports. There's some really good studies at the highest level, of the professional leagues, where you go and ask these athletes, what did you do as a kid? What did you play? And almost every single one of them says, I did soccer, basketball. I did soccer, football, basketball. They name these multiple different sports, and especially early on. So, at a certain point, yeah, there needs to be probably a specialization in it. If this is going to be your sport, you go in, and there's, again, some debate whether that's 12, 13, 14 years old. But, these younger kids, developing other skill sets with other sports is actually super important. So while, yeah, basketball is a very different skill set than soccer, the motor control that they're developing at that age as they're getting older and as they're growing and their muscles and their bodies are getting stronger is super important. And they can then utilize those skills. Well, they may not be the exact sports skills, the athletic skills and the movements of their body, and translate it to the other sports that they're going to be doing.
Yeah, absolutely. It's good for the athleticism and it's very good for the body.
Yeah.
All right. How do you know if a child is doing too much physical activity? What's too much?
Yeah. So I think, generalized, over, like we talked about, those sort of global pains and things like that. If every time after they're coming home from practice, every single time, and you're noticing that they're having pain or they're complaining, then that's, you got to look at, okay, are they doing, too much? I think fatigue, just sort of globally, fatigue is an important thing to notice. And I think we can't forget about the emotional component of doing this, and doing too much. I think especially as, the young adolescents and things like that, the emotional component and getting sort of burnt out is really a thing to start paying attention to. And I think the irritability, I don't want to do this, I don't want to do that, there's going to be some of that comes along with being a teenager. But I think if you start seeing it more and more, and part of that may be, hey, they don't want to do that sport that much, or, other things, or they're just tired. Think about yourself. When you're tired, you're not the happiest person you are a lot of times. And so, a lot of these kids have a lot of things going on. And if they're really focusing only on, the sports, some of the other stuff can begin to suffer.
Yeah, I think that burnout's a big thing for doing a single sport too. Just thinking in my clinics, the kids who tend to get the most burnout are those who just do one sport. I think being able to get away from it a little bit is very good mentally.
Yeah.
So here's a tough one. What are the safest sports for kids with previous injuries or conditions? And it's gamut that it's a really tough question.
That's a hard
one.
I
mean, we were joking, before we said chess, and then Dr. Kurt said, I once had a kid that was at chess camp fall and break his wrist. So I might have to take that one off too. But no, I think every sport, no matter what you do, there's some sort of, risk factor. And again, each one is a different spectrum. So, I won't sit here and tell you that, football's a less dangerous sport than swimming, but they're just different. And so, you have a lot a higher risk of breaking your femur playing football and getting hit but in swimming, you could have, shoulder pain from the repetitive movements, doing things like that. So I don't think there's one sport that you can specifically say like, hey, this is 100% safe. You're never going to get hurt and do things like that. I think depending on the injury and depending on what we end up, how we're having to treat it, whether it's non-operatively, surgically, and the severity of it, I think then dictates, returning back to certain sports. So I definitely have, as Dr. Cilli mentioned, when he does, spinal fusions, he may limit what they do in certain activities. For different injuries, there's definitely some things where I say, okay, hey, maybe we guide you to, a little bit of a different sport. But I don't think there's one sport that you can definitively say, okay, hey, you do this, you're never going to get hurt. Are there certainly risks and valleys of different sports? Yeah, but I think as long as you're doing sports safely in terms of timing, preparation, flexibility, I think you can do almost any sport.
Yeah, I think maybe the better question there is, because kids heal so well from basically everything, I think the real question is, what's the best way of getting them back to sports safety?
Yeah. Go ahead, Kevin.
No, I was going to say that's a great question.
So I think the biggest thing for me when I think about that, I think first and foremost, I think an accurate diagnosis is the single greatest thing. And what I mean by that is figuring out what is actually the problem. And why that's important is, these kids are not little adults, although there's sometimes that 15 and 16-year-olds walk into my clinic. I'm like, who are you? Like, they look like they're grown people, but it's a very different physiology. And so their bones are different, their ligaments are different, their tendons are different. And the injuries that they get are sometimes different than adults. And so it's really important, why it's important to see, a pediatric, orthopedist or a sports specialization that, deals with adolescents as opposed to, the general orthopedist or the adults, is we sort of have our mindset's a little bit different in terms of some of the things that we're picking up on. And I think getting an accurate diagnosis and understanding why that's happening in this child is super important, because then we can go ahead and attack it and get them back safely. And more importantly, understand it to, okay, why did this happen? How can we prevent it from coming back?
Yeah. And in my mind, after a lot of injuries, you're protecting the child, say it's a sprained ankle, a fracture. The kids are then done with the protection. Now they're stiff and now they're weak. So the first things I'm looking for is regaining full motion, regaining full strength. Once we have those, then it's a gradual advancement of the more dynamic type things, getting them jogging. When they can jog well, then let's get them going with 3/4 running well. When they're doing that without any difficulty, without any pain, let's get sprinting. When you're sprinting with no pain, let's get cutting. When you're doing that and your strength, your motion are perfect, then you should be ready to get back for whatever sport that you want to do. My son is a pitcher in 9th grade. This is not my son. What should he be doing after he pitches in a game to maintain the health of his shoulder and arm? What can he do to help build strength? Also, what should be incorporated into warm-ups?
So, yeah, pick that question, sort of piece by piece apart. So, as a pitcher, when we talk about throwing a baseball and specifically pitching, I always thought it was funny, looking at some of and I'm going to date myself a little bit, but Tim Lincecum for the Giants always stood out to me. He was, 5'8", 125 or 150 pounds, and he threw 100 miles an hour. And you watch his mechanics, and he's generating all of his force, as I talked about, from the middle of his body. And so from his legs, his hip, his core, and that's where he's generating that kinetic energy, that force to then be able to throw that baseball that fast. And so when we talk about why do people get, shoulder injuries and elbow injuries with throwing, a lot of times it stems from that hip and core weakness. And so when they don't have that power and that energy generated from the middle part of their body, then they try and get it to get it from the shoulder to speed it up when their shoulder motion is not where it needs to be. So they're lacking internal rotation specifically in throwers. Then it starts putting strain across the elbow. So if you don't have, it's definitely a chain of events. And if you don't have at point 1, point 2, point 3, then that's when those downstream effects, start happening. And so I think in terms of, what can they do to prevent injury and build strength, it's, hip and core strengthening, working on flexibility, specifically on shoulder internal rotation. If you're son or daughter plays an overhead sport and they have not heard of the sleeper stretch, you need to write that down. You need to Google that, and they need to be doing that every single day, because the amount of people that come in with shoulder pain, elbow pain, and they literally put their arms, like this, and I'm sorry, the screen's blocking, and the one arm can rotate all the way down and the other one's stuck here. And I show that to the parents and they're like, oh my gosh. And so it's very natural to have a different range of motion. Throwers all have a little bit more out external rotation, but you got to have a symmetric arc. And so that's what I would really, really focus on, into the training. And then, as Dr. Gerd mentioned, with warmups, dynamic warmups, bring the band to the field, make sure they're nice and loose, make sure they're stretched out, and make sure they're not overthrowing. So really adhering to those MLB, pitch guidelines. Those guidelines were set up by MLB doctors. Those are, people that handle, very high level athletes. And it doesn't mean per team. That's the other thing we need to clarify. It's those pitch counts are for, not just on team A and then he goes to team B and he gets to redo that again. It's for that set period of time for any team that the athlete is on.
Yeah, I think it's a really important point, especially with the overlap of club teams and school teams that has become very prevalent these days. You talk to people and you're talking about, when does, baseball season start? And they kind of in a month, but it's happening right now too. That's sort of, so that's a great point there, that it's to your child, not just to that team that they played on last weekend.
Or little Jimmy, who's on 3 teams, just pitched. Then he went to his other game where he's a catcher, so he's throwing every time too. Then he goes to the next one where he's the third baseman and having to throw it all the way across, routinely. First base isn't a bad thing too.
Yep.
I would say break.
I've seen the overuse throwing injury in catchers too. That's one that people don't really think about as frequently because it's not quite the same velocity, but it's the same motion. It's the same number of throws. Yep. And so I've definitely had to have some of these conversations with families of catchers as well.
Mm-hmm. Can throwing through forearm or bicep tendonitis lead to further damage? And I think this is a good question because it can lead to so many other things. How do you know when it's too much pain to stop? Not just in the forearm, but
yeah, and I think, again, it comes back to inaccurate diagnosis. Where is it truly, a forearm strain? Is it truly biceps tendonitis, or is it a problem with the growth plate or something like that? And so I think if you're starting to get, persistent pain after throwing consistently, that's probably when you need to be evaluated. And again, we usually would get an X-ray, of that elbow, make sure, especially in a growing kid, that growth plate's not starting to get wide, that there's not warning signs on, the X-ray, because you keep going through that, and you can make this worse. Or you can even, pull off a piece of bone, create a fracture, have, more permanent, or not permanent, but more significant injuries than just like throwing through it. So.
All right. And then what role does nutrition play in bone and muscle health for kids? And the next question are supplements like calcium and vitamin D. And I'll start this one. Nutrition is super important. Sitting on the couch eating cheesy puffs for anybody, but somebody who wants to be an athlete, man, you have to fuel your body. You have to have calcium. You have to have vitamin D. You have to have protein. You have to have a well-balanced diet. You're putting your body through a ton, and you have to give it the fuel that it needs to be able to do what it wants to do, but also to heal itself. Every time you're out playing, you're creating micro damage in the bone and the tendons and the ligaments and the capsules. And your body has to have time, like we talked about before, to allow that to heal, but also the right nutrition to allow it to heal. So I think that's super important. Getting enough protein, getting enough calcium and vitamin D. And then the supplementation, does everybody need supplementation of calcium and vitamin D? Probably not if you have a good diet. Now, winter months in Cleveland, you're not getting a lot of sunshine. Sunshine helps to convert vitamin D into active vitamin D. So for an athlete, and really, in my mind, probably for all of us, having vitamin D supplementation throughout the wintertime is a really good idea. If you look it up, it could be anywhere from 400 to 2,000. I think 1,000, 2,000 for an athlete is probably a really good idea.
Yeah. there's at some conferences recently, there's been some presentations about folks looking into vitamin D supplementation after kids who have had multiple fractures as well. I know I get that question a lot in clinic. Hey, does my child have a bone disorder essentially because they've had multiple fractures? And the answer is usually no. It's probably not going to be one of those more rare conditions like osteogenesis imperfecta, although certainly we're always keeping an eye out for those things. But the reality is, if especially living up north, if we've had multiple fractures, there's a chance we're going to be vitamin D deficient, and so there's been kind of a push to lean maybe a little bit more on some vitamin D supplementation as well, particularly in kids who have had multiple fractures.
So yeah, I think that's super important. The other thing that I try and push is resistive exercise. If you're doing things like push-ups, planks, appropriate weight training, which we may need to get into that too. I don't know if we'll have time. But doing things like push-ups where you're putting resistance through the bone forces the body to lay down more bone to make it even stronger. So, there's all different levels of athletes, right? Some are working out all the time. They're getting that. For those kids who are in a sport, 1-2 days a week, and the other days of the week they are on their phone, finding time to do resistive exercise, to do push-ups, do planks, do core work is so important on a routine basis. Kind of going back to where we were before, but
great point. Absolutely.
So what's the best approach for helping kids recover from a sports injury?
Yeah, I think we've touched on a few of those things, but it's the answer they don't want to hear a lot of times with these overuse things. It's rest, and so sort of minimizing the mitigating, factor. And so, if I see a kid that's got a quote unquote little league shoulder or something where I got to shut them down from throwing, but as you had mentioned, it doesn't mean hey, we're shutting you down from everything. So I say, we find sort of things that they can do. Okay, if it doesn't bother you to hit, you can hit. Okay, you can still field, you just drop the ball and put it in a bucket. And so I think just understanding that, hey, a lot of these things are due to doing too much, and we need to just give it the appropriate time to rest.
I think one point this kind of ties into a question from some of the folks attending today too. I know there was a question about working in collaboration with physical therapists, both, from a rehab after injury standpoint or on, some of the other more day-to-day type stuff that we've talked about in the past. But how do you sort of work with physical therapists in your practice?
Yeah, I think physical therapists are huge. I mean, the amount of times that I joke and I say my job's easy. I diagnosed you, but the hard work is going to be on the patient, the family, and with the physical therapist, because they spend way more time working with them and seeing face-to-face time than I do in the clinic. And so I think physical therapists are an integral part of any sports practice, and any athlete at some point is probably going to see them. They have a great knowledge set, especially the ones at the Cleveland Clinic and as well as, and a lot of them in the community we interact with. But I think getting them back to, as Dr. Groot had mentioned, it's not just when we heal the injury, it's then all of the after effects of being down for a period of time that I'm worried about. If I treat, the bone heals from a fracture, but then, okay, you've got quad weakness, you've got something else. We're trying to prevent that next injury. And so using the physical therapy and to really help build them back up to where they're getting to this point in sports where we're minimizing that risk of re-injury again.
What always cracks me up with physical therapy is the kids who say, I did therapy. And I say, well, what does that mean? They say, once a week, I did exercise with them, and that's it. I'm like, are you still doing it? And they say, no. Therapy, I always tell them, therapy is your teacher. They're showing you what to do so you can routinely, consistently do it at home. That's the way to get better. You can't just do it with a therapist.
Yes, the most important part of physical therapy is the programs that they teach you for home. If you're not doing those, it's just not going to work.
Correct.
Well, I think we are running down to the final minute. Is there any final thoughts that you guys would like to leave with?
Yeah, I think it's, at first and foremost, we want to say, hey, sports are great. Get kids in, get them, keep them active. I think that there's been shown to be a lot of immediate, midterm, and then long-term effects as they go into adulthood of being active, at a young age. I think, they build a lot of different things in terms of character, team building, and all of these different things. I think we need to recognize that, hey, they probably don't need to be training 25 hours a week to be the next, LeBron James. And there's been, like I said, some really good data that shows, getting in and doing multiple sports, especially at a younger age, is actually really beneficial for kids and probably for the parents as well.
Yeah.
Yeah.
Yeah. For me, I wrote down the things I wanted to get across. Make sure that we talk about the flexibility and stretching, dynamic warm up, how important those are, nutrition, super important for any athlete. And then just like Ace, thinking sports are positive. It's great to do sports and do sports for as long as you can. Being 50 years old, doing sports, wonderful. Great for you socially, psychologically, emotionally, and it just builds a fitness routine that you can take for the rest of your life.
Absolutely. I think it's awesome. I think that, I think all of us here played sports growing up, and we still, beyond just exercise habits, I think there's a lot of mental benefits to it. There's a lot of things that you learn that you take, down the road for the rest of your life. And so I think it's an awesome thing to be doing. I think it's, obviously we want to do it safely, but certainly I would never discourage, families from getting their kids into sports. And then if you didn't hear us say it enough times tonight, I think flexibility and core strengthening are, I don't think we can say that enough times ultimately.
Well, Kevin and Ace, thank you both so much for your time tonight and for your wisdom. Thank you for everybody who joined us. We really appreciate you being here with us, and we hope that the discussion was helpful. This has been recorded, and you will be getting a emailed copy of it sent to you. So, and if there's any questions that any of the three of us can help with, please reach out, and we're happy to help in any way.
Yeah. Thank you.
Thanks, guys.